10:50. So we can, oh, now it's recording. So we can make that no problem. So that break will be at 10:50. And so during this time, we are asking for group participation. Mostly it will be through this online tool, this Jamboard online tool. And then we will also have some discussion, some open discussion as well. As we're talking about this, I'm inviting you to show up today, not only representing your organization, but also your sector. So you're going to be wearing kind of two hats today. So you're going to be representing yourself and your reflections, but as well as your sector. Time is going to move quickly, especially this first part. It's going to move pretty quickly. And so we're going to try to cover all the areas and make sure that everyone gets to that break. At the end of the breakouts, there will be an opportunity to share some key takeaways from this session. So you know what that means? We need a volunteer. We need someone who is willing to take some notes and share those key takeaways with the full group. Because I'm a facilitator, I don't have the institutional knowledge that you do, so it would be much more beneficial if somebody from the group feels really good about presenting the viewpoints of the group and the work that we're doing here today. So let's run through Jamboard. Hopefully, most of you have used this before, but first of all, do you all have access? Did the link work, Evelyn?
Yes, it worked for me. Mm-hmm.
Okay, good. Well, if you all have access to that now, we're going to run through just a practice on this first screen. And so you are going to, you're going to start off by just putting a little sticky note, and that is on that left side, the fourth item down that looks like a sticky note. You're going to click that. You can choose whatever color you want and put whatever you want in that sticky note. And so I can put my name in there and post that. So if we can do a few of those just to practice a little bit, make sure that it's working for everybody. You don't have to worry about where you put things because I can make those adjustments and I can move them around. Good deal. We have a great group. I was looking at the list. We have quite a roster of people that are interested in this programming piece. And so we're happy that you're here. Does anyone else, looks like they've slowed down a little bit. Does anyone else need to post? I have not counted how many people we have in the room. Evelyn is my right-hand person here. She is helping out. And Evelyn, you can kind of keep an eye on things as we go through. Okay. So any questions about how to use Jamboard? Looks like y'all are pretty comfortable with it, right? Okay, good deal. All right, so now we can go right into strengths. Now, for each of these slides, we kind of have a little format. So for this first slide, you're going to take 2 minutes to reflect individually, so not posting yet. You're going to take 2 minutes to reflect individually, and I say that, and hopefully we have enough time here, but we're going to take 2 minutes to reflect individually about when you think of physical activity programming in your community, what strengths can you leverage to move this work forward? So you want to think about your top 2 to 3 ideas that you would like to share. You're going to share them on one per sticky note when it's time, but just take a couple minutes just to think about what strengths you can leverage to move the work forward. And I'll set the timer.
Tina, I'm not sure. Were you supposed to share your screen or no?
Oh, thank you so much.
No
That's
problem.
the essential element that I forgot to do. Okay, sorry about that. Can you see it now?
Yes, and I guess sharing the Jamboard.
Oh, it's the wrong one. Hang on. Let me share the other one. Okay, is that better?
Yes, thank you.
Oh, thank you. I was too focused on the time and not on the details. Okay, so we're about 1 minute through. We're going to round this out with about 20 seconds left. Okay. So now we start thinking about, oh, my timer's too loud. We can start thinking about what you would like to share with the group. And you can do that again on one idea per sticky note. And we're going to take about, I don't know, a couple minutes here to share. Again, you can use whatever colors you want. You can use however you want to do it. But share those thoughts about what strengths you can leverage to move the work forward. Again, this can be your personal as well as for the organization or other portion of the community that you represent. So we have one here. Here we go. So we have partnerships, we have physical structure, event management, childcare. So we have, as you guys can read through these, and we're going to take a little bit of time to reflect on them. I think it's always good in any process to start with strengths. It's always good to talk about this is what we can do. And this is what we already have in place. We don't have to necessarily build this. We could build on it, but we don't have to build it. So if you're looking at this, you're looking at several different ones, and they're still kind of coming through. Feel free to continue adding as you're going through this. And we were thinking about a couple of them for each of you. So when you say desired outcomes, you mean that we've identified our desired outcomes. Is that right?
Yes, I would say so.
Okay. That's a big one. For sure. Okay. So now, and continue adding, please do continue adding. We'd love to fill this up with lots of ideas, continue adding, but we're going to take a little bit of time now that we can reflect on what other people have shared. And so as you're thinking about this, think about what other people have shared and how, and what that says to you. You know, really how that speaks to you. I'm going to take a few notes as you're talking. I think Evelyn might be taking some notes as well. And because we want to reflect this back to everyone. So when you look at these, and we're not going to go through every single one, I would love to, because I'd love to learn more, but I'd love for you to tell me about what they say to you. So what do you see there? It can be your own, it could be another one, but what speaks to you?
I mean, I would just make a comment that something that I see is that there are a lot of partnerships and connections among, the different groups. So maybe that's something that I think it reflects as one of the strengths. There is different connections and partnerships among different programs and things like that throughout the sectors.
Makes a big difference, doesn't it? Goes back to that we can't always be the only one doing it.
I feel that somehow we need to be able to work with our collaborative partners, especially the Parks and Rec and community centers, in having affordable options for families. I'm from Clay County Public Health Center. We serve a lot of kiddos that are from underprivileged families. And I think that the cost of either playing in the little leagues or joining the community center is prohibitive to so many of our families.
Mm. And we are going to talk a little bit about challenges here in a little bit. So let's definitely readdress that one then. I'm going to put it in the notes for here because I think it sounds like a theme. And that's another thing. Do you see themes like that?
I think there's a couple notes that say, like, there are great facilities. It's just leveraging those facilities and are they being used to the maximum? The parks and the different community centers for physical activity, they're there. And several of them are very nice, but then utilizing them the way that they are meant to be and really maximizing them.
That's a great one. It can be a great idea, but then it's the, if you build it, they will come, but sometimes they don't always come too. Anything that surprises you? Anything that you look at it and you think, gosh, I didn't know we had that. I didn't know we had that as a strength. I learned something new today.
I think the adapting programs for disabilities, I mean, we know it's there, but sometimes it's not highlighted or shared. And so really capturing and promoting that as a positive strength is something important.
Very good.
Yeah, and it's the current relationships with child care center is not something that I would have thought of. I'm thinking of, more of the public schools, but that's also like a really good outlet as well to really partner with the child care centers.
That's a great one.
I think something kind of piggybacking on the statement about adapting programs. I'm a physical therapist. I adapt programs all day long. But like was mentioned, I don't know that they always tap like already established community-based programs, think to tap into how they could access providers who could help them support those individuals with disabilities participating greater. We do have some really great programs already established, but finding them and sharing them with families, maybe even at the school level, it's a positive, it's there, but I think that also speaks into some areas of growth that we're going to talk about later too.
Sounds great. And I love the fact that we just had another addition. And so as you're going through this, if you have other additions or other things you'd like to add on to those strengths, put them in your chat and I can go back and I can add those in on this page. But looking at our time, I think we're going to go ahead, if it's okay with the group, I think we will go ahead and start talking about opportunities. And there may be some overlap here. There may be some overlap with the strengths and maybe some things that we've talked about, but let's think about this, think about it here. Again, kind of the same formula. We're going to take a couple of minutes to think on your own. So when you think of physical activity programming, what are the opportunities? So to me, an opportunity may be something that already exists. It needs to be leveraged. Maybe an opportunity is something that could be created. But what are the opportunities for collaborations are there? So your opportunities not just to work within your own organization, but your opportunities to collaborate with others. So we're going to take a couple of minutes to write those down. And then same thing, share it out on the Jamboard as one per sticky note. And so put those out onto the Jamboard, and we will start our time now. We have about 10-ish seconds left. And you can, and I noticed several people have already started posting, which is great. I'm excited. I'm reading these, and it's interesting how many of these are themes that are common in every community. So as we're looking at these, and I think we made up a little bit of time, so now we get to kind of, now we get to breathe just a little bit. We made up a little bit of time. Again, our break is at 10:50, so we have a little bit of time to look through these. And we're going to reflect on what others have shared. So I know that the first couple of them were leveraging with local clinics and healthcare experts, promoting exercise opportunity, after school activities. Those are the things that are, they jump out at me partially because where I'm at in life. But what jumps out at you? What do you see there? Similar to what we did before. When you look at this, let's talk about it. You can talk about yours. You can talk about what someone else put. When you think about collaborating, especially.
I mean, we're doing it during this meeting today, having the multidisciplinary and kind of cross collaboration, but I still feel like that's an opportunity to continue to improve and grow upon. These platforms are great, but then sometimes when we go back to our individual organizations as well, we still have those silos that makes it difficult to break down those barriers and to kind of leverage everyone in the organization or the opportunities and the connections, and just put it out more to the public and beyond just kind of these large coalition groups.
Yeah. Any ideas how?
That's a great question. I think just continuing to have the conversations and bring people to the table, even if somebody in your organization or another organization you wouldn't think would be somebody that would want to be at the table, continuing to invite them, and just provide the opportunity, I guess.
Yeah, that's a good answer. Very good. Who
Yeah,
else?
and see, someone else mentioned promoting alternative exercise opportunities, and I think that's important. That's an important message to get out, is that, you know, you can get exercise just, you know, doing some gardening or, you know, walking in your neighborhood. It doesn't have to be this strenuous run a marathon, lift weights, but just really, you know, making sure people know, you know, what are some of the daily activities that they could be doing to help, you know, promote their health.
And so a lot of good opportunity for collaboration there, because you can work with other groups to say, you know, what are the messages that work for the people that you know, maybe trust your voice too. What's another thought?
I think for me, it's the greater advertisement of the programs. There's a lot of programs that I just don't see all the time unless I'm in that facility or I'm in that area. So I think that lessens the impact that it could have if we could promote these things a little better. And maybe the connections that we're making today could be a good start, where we can all sit at the table and we can kind of advertise each other's programs.
Mhm. Is this the first time this group has come together? I apologize for such a new question, but is this unique in having you in the room, everyone in the room together?
I would say so. I mean, for me, I think I'm just seeing some different organizations and people that I've never met before. So
Yeah.
So I believe that the summit is every 2 years, and I believe we have probably members of the sectors and guests as well.
Okay. Thank you for answering that for me. Sorry. I'm just always curious about how communities work together. Okay, so as we're looking at this and we're kind of still working through it, and if you guys want to flip back to drinks, we can do that too. But we are looking at, you know, what's surprising or exciting to you, what jumps out at you from this board. What do you look at it and you go, oh, I never thought about that? Or what's missing? What's missing as an opportunity that has not been identified?
This kind of goes back to my comment about the silos, but even just being in the interesting metro area that we're at. I lived in DC prior, and then it's still kind of like you have Virginia, Maryland, DC, like Kansas City. I feel like it's very similar in terms of we have, you know, we have Johnson County, we have the counties on the Missouri side, the counties on the Kansas side, and then like kind of the Kansas City metro, like the downtown. And so it's just an interesting group. And I feel like sometimes it can be, we don't know what is just happening right across the state line, and like learning from each other. And that kind of goes back to the whole silo collaboration. But, you know, it is interesting because each state kind of has its own policies and its own state goals and objectives and programming. And I work for K-State Research and Extension, and we have our own programming. Missouri University has their extension program and their programming. So it's just interesting. And I think we can capitalize and learn from each other more, just because of this unique dynamic that we are in, being in this metro area, kind of on the state line, and all different organizations and universities that are doing work. So
Yeah. We just had a really interesting conversation this week about sharing of immunization records, you know, for individuals that maybe their primary care is in Kansas or they received vaccinations in Missouri, and sharing those back and forth. So it's it is a really interesting dynamic, you know, and like you said then, but what we heard was, you know, immunization records can be better with EMRs from other places. So it's a really fascinating thing. But they also similarly say, create a calendar, because we don't necessarily know what's going on. We don't necessarily know what's going on in the metropolitan area. So it's really important. Are you seeing any themes for this group? Are you seeing any themes related to that physical activity programming? Are you seeing any themes that emerge from this? Because later on, after the break, we're going to come back. We're going to talk about priorities. We're going to talk about, the things that are really important to you, and after we talk about challenges, and we're going to talk about those priorities. And so, are you seeing any themes through this that it's starting to kind of pop out at you that you think, gosh, yeah, this is something we really should pursue?
I think one theme is, getting the word out about existing programs, just so people are aware of it. There's a lot of great programming going on, and not everyone may be aware of it. So, and as part of the mass media sector, that's one thing that we are going to work on, and hope to be able to, promote some of those different activities and help all the different sectors that are working on some great events and programming, and leverage that and get the word out to, all the different groups.
Yeah, that's great. Be able to share that word. I'm glad you're here today. That's good. Because in the old days, we used to just do press releases, right? And so, but to have that actual intentional, the intentionality for mass media, also to say, this is something that's intentional for us too. And that's really, really important. Okay, we have like 8 more minutes. And if you guys want to, we can flip back to strengths. We can do that. Again, after the break, we're going to talk about challenges and do a debriefing. So again, on that debriefing, you're going to be talking about what are the things that, really stand out to you. The example you just gave there, Melinda, might be an example of something that really stands out to you. So that'll be that last section. But for you right now, we can talk again about some of the ideas and the thoughts that have been shared.
I kind of have a question for the group, if that's okay. So I know, for example, I'm part of the waiting team, at Children's Mercy. We try to create newsletters, to promote information. It could be programs or, events that are happening, around the community and things like that. But do you feel like that's a good way to share information, like through newsletters, or what could be the best way to, share more information about like the different programs that are happening or other things,
I think newsletters are great. Oh, sorry. I think newsletters are great, but I also think there's several, and they just sometimes get lost, and not everyone reads them because you're like, oh, it's just another newsletter. So I think newsletters are great. Every organization kind of has a newsletter, and how those can be kind of joined together, or as you said, kind of a central, I guess, sharing. But I know for me personally, they just get lost in my emails sometimes when you have several newsletters coming from several different organizations.
Yeah, and I agree too. So those are a great way to really kind of connect with our sectors. But then if we're thinking about a broader audience, we want to go to them where they're looking, whether it's social media or doing one of the things we're looking at doing is partnering with a local communications company. And we have maybe a little bit of funding, I don't know how much, but something where we could do some digital advertising that might have a broader reach, and target some of the people that we want, that aren't right now, are kind of getting lost and not getting the message. And one of the things I kind of put on here too is, just looking at the different collaboration groups that we want to reach out to, like neighborhood associations, getting families involved in physical activity. I think, really partnering with those groups could really help, promote and our message. And even if we kind of tailored some specific things to a neighborhood, and somebody from one of the sectors could, speak at a neighborhood meeting. So just things like that is just trying to find people where they communicate to people where they're at. And that's some of the discovery that, that we still need to take. And we're working on that.
I think a lot of the organizations I'm a part of or that I encounter are themselves small nonprofits with a shared interest, a group of therapists who are really passionate about something or whatnot. And we might have things, but we're too small to be able to go around to all the neighborhoods or things like that. So is there a central place for Kansas City where we could ask for it to be posted? That's not necessarily directed to social media. Not everybody has social media or uses each different social media differently or whatever, but even just like a website where we could be like, hey, could you put this on your calendar and it links to our event or organization or whatever. And I don't know who that is. I don't know where that starts from. But somewhere that, like, as I'm talking to families, I could say, go to this, because I live in Kansas. I work downtown on Missouri side. I service kids from all over both states at different points. But so having one place type thing like that, that if we could start to advertise that out, maybe, I don't know. But something like that, where it's like a one click and then you could branch off to whatever that was more appropriate for your needs or your community or whatever.
Yeah,
I
and
can-
definitely we set a centralized website once we get the kind of, here's the branding and message that we want to promote. Definitely having this central repository website where we could direct, neighborhood associations, schools, and any type of, or parks, where they can get the resources tailored to them. So that, yeah, definitely is something that is in the plan.
It's as simple as, Variety. Casey's done such a great job of creating so many different accessible playgrounds and things like that. And I can't even tell families where to go find all of them. The last time I tried to look, and things like that. And I could talk to Deb about that specifically too. But like, that's just one example of those types of things. But that could be for any child group, not just that specific group or whatever.
Yeah, I kind of agree with you, Jessica. I feel like I have heard that before as well in some of the other meetings that I have been part of, like as like a place where they can all go and find resources or like events like the calendar you were mentioning. I mean, I know that we have the Kansas City Physical Activity website, so but maybe that could be an option, I think, as well, to have all that information. Perhaps.
So we're almost at our time. So is there, and I don't mean to cut anybody off because we're going to get back together. And so we can always pick up with that left off. But is there anything anybody wanted to make sure and say before we're put back into the main room and into the break session? Okay. So as a reminder, when we come back, we're going to talk a little bit about challenges. So what gets in the way? What gets in the way of our goals and our aspirations? And then we'll talk about, and we'll go through and do a debriefing after that. So enjoy your break, and I'll look forward to seeing you in a little bit.
Hello, everybody. I think we've all arrived back from our breakout rooms. So now we're going to begin a 10-minute break. And the first 5 minutes, we've got a physical activity break that we'll share. And then the second 5 minutes will be just a personal relief break, time to get a drink, go to the bathroom, things like that. Feel free to leave your camera on or off during the physical activity break, but we do really want to model good behavior. And so please get up, move around, stretch yourselves out. I promise you're going to feel better.
My name is Bryce from the Center for Children's Healthy Lifestyles and Nutrition at Children's Mercy, Kansas City, where we work to promote children's healthy lifestyles and physical activity in the Kansas City region. Today we're going to do some exercises and some stretches for you guys. Most of these can be done while you're sitting or while you're standing. So let's get right into it. The first one we're going to do, we're going to lock our fingers and we're going to stretch all the way up to the ceiling. Try to touch the stars. Get on your tiptoes a little bit, and then we're gonna bring our arms down, right behind our neck. Bring our elbows in, and let's rock back and forth. Right, left, right, left. Good job. All right, back up to the starting position, and now let's get some head circles in. You might hear some cracks, that's okay. Good, and now let's get our whole body involved and let's shake things out a little bit. Get ready for some of these main stretches. Awesome. Let's bring our arms up and we're gonna do some core twists. We wanna get a little bit of a wider stance. We're gonna go left, right. Nice rock solid. Perfect. All right, and all this can be done in a seated position as well. It would be this type of variation. And we're gonna move on to the next drill. So we're gonna do some knee pulls. We'll start with our right. You wanna grab right below the knee, pull up towards our chest, hold it for about 5 seconds. It's okay if you lose your balance, find something next to you, find a table or a chair. You can hold your balance just like that. If you're seated, you can do this variation. Back to our right leg. Good job. All right, and then we're gonna transition to some toe touches. Touch our right toe. Try to hold that for about 5 seconds. If you can't touch your toe, that's totally fine. Just touch somewhere in your shin. See how far you can get down. 3, 2, 1. Awesome. If we're standing, it's gonna look like this. See how far you can get down that shin. Try to touch your toes. Awesome. Nice and controlled. We can focus on our breathing in through our nose, out through our mouth. All right, we'll do a quick hamstring stretch now. Our right leg, we're gonna reach down, grab that foot, pull up towards our butt. Good, hold for about 5 seconds. Awesome, left side. 2, 1, good job. If you're in the seated position, it looks about like this. Get a good stretch in. If you're not able to grab your foot, that's okay. The variation would just be leaning back and trying to reach down with your hand as far as you can. Good. All right, on to the next one. We're gonna get a glute stretch in now. When we're sitting all day at home, this is a good stretch to make sure that things are activated. Our big muscles in our body are activated while we're sitting down. So we're gonna bring our right leg up, sit our ankle on our leg. We can lean forward for a better stretch, hold it, and then we can lift up on that leg just slightly. Good, we'll go to the other leg. If you're standing up, it looks something like this. Good, lift it up a little. Okay, and our last one, let's connect our fingers again. Let's reach to the stars. And let's slowly flow down into a forward fold. Grab those elbows. You can sway to the left and the right, left, right, sitting down, looks like this. Left, right, okay, good. There we go, guys. Thanks for joining me. These are all exercises you can do at home. And as we're sitting at home, if you're working from home or in a seated position throughout the day, these are fantastic ways to get moving in an easily accessible way. Thanks.
All right. Hopefully that loosened you all up. We'll meet back here at 11 o'clock to start the breakout session number 2. All right, everybody, we're going to head back into the breakout rooms again. And hope you're having a good discussion. Just a reminder to the weighing in support and the facilitators, let's make sure that the breakout sessions are being recorded as well. The recording in the main room doesn't carry over to the breakout room. So just make sure we do that. And Tico, you can send people to breakout rooms whenever you have a chance.
Did you press the recording button?
I did not. It
Okay,
was
so-
automatic.
okay,
Yeah.
maybe it's mine still. Just wanted to double check.
There we go. Okay, because I was only showing like myself, and I thought, oh no, I lost everybody at the break. So I'm so glad that I have many, many more people than just me. And I remembered to share my screen this time. So can you see it? Good.
Yes.
I'm glad. So we're so happy that you guys are back and ready to continue our discussions. We hope you enjoyed the break. I really wanted to have that video afterwards. I hope he shares that out. That would be a nice thing to do on a regular basis. So we're glad that you're back, and we're going to talk a little bit about challenges. So challenges, again, are when we think about programming, what challenges might we need to be prepared to overcome? Which I think is a really important part of this, because, you know, some challenges are challenges and some challenges can be overcome. And so if we think about it in that mindset of it's a barrier, it's a boundary, but how can we overcome it? And how can we do that? So formula is the same, and we have, this will not feel as rushed this time, which is also nice. It's not going to feel as rushed. And so we've got about 15, 20 minutes to stay in this space and be thinking about challenges. So when we think about this, we're going to take 2 minutes to reflect individually, brainstorm, think about what are those challenges. So if we had thought about opportunities last, and what are our opportunities for growth? What are opportunities to work together? This is kind of the balance to that. So I'll start my timer, take 2 minutes, and we'll think on our own. And absolutely start sharing whenever you want to. So we have about 10 seconds left. Okay. Now we go back into this open discussion time where we talk about what we're seeing. You can absolutely continue to put more thoughts out on the board. We love all of them, and you know that goal of 2 to 3 ideas is a great one. If you can think of those, that's awesome. So as we're looking at these, I thought it was, I have to say that very first one that popped up made me chuckle. The money and time, which costs money. I love that because that is so true. And then we have time and we have affordability, which is not necessarily the same, but is connected. So when we're looking at these, those are the things that are jumping out at me. What's jumping out at you? What do you look at this and you're reflecting on what other people are saying and you say, yes, that makes sense.
the comment about the disinterest in physical activity, obviously it's a big one. How do you get someone engaged when they have no interest and do not see how it would benefit them? And kind of going back to the presentation that the mass media group saw, where Midwesterners it didn't resonate with them, the benefits of physical activity. So how do you get those people interested, and what is going to get them out the door and use some of the programming that we have?
And did you mention in the earlier session about that also, that kind of taking the leap that not all physical activity has to be done in a gym? Were you the one that mentioned that, or someone did in the last session, that, taking a walk and doing gardening and other things also can be physical activity as well?
Yeah.
So, reframing that message. Not to be too personal, but I frankly have that conversation with my 20-year-old son, who's a football player, on a very regular basis. he thinks all physical activity must include lifting weights. So, okay. What else is standing out to you?
A lot of this could fall under that one about access, because finances, time, location, all of those, even just when they get there, can they access what's being presented? That's a big umbrella covering a lot of the things.
Did I see transportation too? Yeah, that's a big one. Do we also add in there working multiple jobs? And I guess that goes into time, doesn't it?
For me, from a programmatic perspective, I don't just focus on physical activity. Some organizations, obviously that's their key focus is physical activity. For me, it's nutrition, food safety, and health, which falls under physical activity. So the competing priorities and, how to prioritize what and when, and just sometimes, you feel like you're too stretched thin, even though you want to create this great program or get involved with partners that are doing this great programming for people who aren't necessarily doing physical activity. It's sometimes a stretch, and just, finding the time and prioritizing all of the balls and pieces that you're working on.
So when we think about that, I'm so glad you mentioned that, because when we think about that again, in the idea of collaborations and the idea of working together, so then you're saying physical activity is a part of what we do. So how, when we look then again at challenges, then how do we think about the challenge? And I don't know your organization, sir, but how do we think about that as a challenge between organizations working together? Have you experienced any challenges in that?
Well, for me, my challenge would be having enough time to partner and meet with the organizations who are doing physical activity as their main priority. I've had some conversations, but it's, again, being pulled in a million different directions and following up on it. So for me, I wouldn't be taking the lead necessarily, just because of it's more of the partnership piece. But for organizations who don't prioritize it, you want to have a seat at the table, but sometimes it's hard because you can't be at all those meetings that are focused on physical activity and be involved in all the conversations, I guess, is maybe where I struggle from my perspective. Like, I want to be engaged and to be there, but I can't when I have, so many other focuses with nutrition and food safety and then health all encompassing. So I guess finding that balance between being involved, having a seat at the table and contributing, but also, fitting into all the other areas of your work.
Yeah. Thank you. I appreciate that, because you really framed that very well as a challenge to that collaboration. I think you did an excellent job of framing that. What are for others, and we are always wanting to hear from everybody, you know, as much as everyone wants to participate, we really do want to hear from everybody too. This is a great opportunity to say, what's surprising you? Maybe this is the first time you've been in this conversation, you know, so you may look at this and say, I never thought about that as a challenge. Or what themes are you seeing that are coming through?
I think that well, I support the Waiting In team, but my main role at Children's Mercy is that I'm a research associate. So I'm working, I will say, with the community and just trying to get input, you know, and I mean, just trying to bring that perspective when it comes to challenges and things like that. I think that focusing on like the social determinants of health and how they influence, you know, how participants think about physical activity, because something that I always think about is like, if you are a parent or, you know, just someone in the community and you have to think about food and, you know, transportation and all of that stuff, you know, how can you think about like health and, you know, physical activity and just, you know, things like that. I think that's also a challenge, you know, that the community members face.
Yeah, that's really important. And especially bringing in the social determinants of health as well is a really important part of that too. We think about how that oftentimes whenever we're with different programs as well, or not different programs, but different organizations, that we don't always consider all of the social determinants of health that are impacting the lives of the people that we would love to serve. And so I think that's a really important piece of that.
I'm reminded on a daily basis that, like, it feels like growing up, I grew up in Western Kansas, so not this metropolitan type feel that I'm living in now. And my life was pretty cookie cutter. It was everybody, we were similar social statuses, everything else. We didn't have the variety that I work with now. And I think I grew up thinking that like it was third world countries that had those struggles and things like that, and didn't like realize the extent that some individuals are facing right here, down the street from where we live or next door, and things like that. So as a provider, being reminded about that, but then also being given resources and tools to help them access those things, or access those basic living needs, so then maybe they can consider this as a priority or things like that. As we're speaking to providers too, I mean, we talk a lot about getting participants to these programs, but as we're speaking to the providers out in the community who might be, whether they're the teachers or the doctors or the therapists or whatever that are sharing these with families, like knowing what resources can help too. Like, is there an opportunity for scholarships? Like, is there someone in the community who's like, yeah, I'm going to give your program this much so your participants can be scholarships, like their whatever can be provided for them, or whatever are different opportunities, I guess, that you guys have got me thinking about this morning.
That's good. So you looked at that, you said, hey, here's a challenge. It's been mentioned a few times on here. Here's a challenge. And then this is a way that we can get through that. And that's a great example of that. I have no doubt that there would be many individuals that would love to sponsor, but need to know how as well to be able to sponsor those that would like to participate. So this is a great conversation. We got about 5 minutes left in this section. So have we looked at everything that's on the board? Have we talked about the things that have been noted on the board that are listed as challenges? Anything on there that jumps?
They definitely. Oh, go ahead.
No, go ahead.
Language barriers obviously is an issue. I live in the old Northeast, and we have definitely different multiple cultures and people who speak multiple languages, and how to, get the message out to them can prove a little more difficult. And I think I think that's important, and they're a group that really would need some of this messaging, but that can be a challenge of, finding ways to, get the message out to them and have it in their language.
Mm-hmm. And haven't we all, well, maybe not all, but I know in my past, you default to English and you're so busy and you get that flyer done and you're going to move on to the next project, and you don't step back and think, how many languages are spoken in my community? And that is a definite challenge. Absolutely it is. The immunization project we're working on, we're working with a group that they hired a community health worker who speaks Swahili to work in Wyandotte County. I would not have thought of that, and glad that they can find someone, but definitely a broad variety of languages.
Well, and just adding a little bit to that is like, I feel that, again, I'm coming from research, so in research, we're trying to, engage non-English speaking communities as well. But I think there is like a process, that we kind of like to follow, when we translate materials and things like that. And something that I really like that we do is that we try to engage the community members, or like the target population, to develop those materials. So I think that community piece, like immersing yourself in the community that you're trying to target, and it could be through advisory groups or, things like that. It's a really good way to tackle the language barrier, that sometimes organizations are facing and things like that. So trying to coordinate with community leaders and community members and things like that, I think is very important.
Yeah, and that's a good point as well. The working with their community leaders, community members, the trusted voices in their community, the trusted voices that say, yes, this is a good place to go. This is a good program. This is a good activity to participate in. This would be great. And that can make all the difference in the world. Okay. So as we're looking at, we have about a minute left of this before we move on to our next section. Anything else? Any other voices in the group? We have some great contributions. I really appreciate the contributions we've had. Anything else anybody would like to add on this section? Okay. Hearing none, I say we move to priorities. So we have time to reflect on all of this work that we've done today. So we have time to reflect on the strengths, the opportunities, the challenges, and now we have time to reflect on all of that and to think about the priorities now for your community. Now remember that we need someone who's willing to speak to the full group as the voice of the group. Would make me more comfortable if we made this decision now. Is there anyone who is willing to volunteer? Because then that way you can be framing your thoughts as we go through this section. Some great voices.
I'll go ahead and do it.
Yay. Thank you so much. I just think it's good for you to know if you're going to be the one to do it before we go into this section, so you can be thinking about your thoughts. So thank you so much. We'll all clap for you and give you a round of applause for doing it, but I have no doubt that you will represent this really, really well. So now we have time to think about the work of today. So now we can reflect on the ideas that were shared and what's standing out to you. We don't. We are going to then put top 3 priorities on a sticky note to put on the board. So this is a little bit different format. It's not 1 per. This is a 3 on, and so, but we can talk first, and then you can place them on the board. So when we think about some of the priorities and things that you have talked about today, what's standing out to you? What do you think are some next steps? And we'll discuss open, and then you can put them out there. And we have another 20 minutes.
I think that the priority number 1 is probably coming up with that central location that we've been talking about, like choosing the platform and the location of where that where we can find all the resources and, you know, items to connect with other programs. So I think coming up with that might be the best, you know, like the first priority, I guess.
I have thoughts on that, but I'm not going to talk yet. So let's see what other people are thinking.
Right. Another priority is solidifying the partnerships that we identified under strengths, and making sure that they know, what we're trying to achieve, and make sure that they have buy-in on the process and are willing to be a strong partner with us.
So I flipped it back over to there, and were there any of these that really stood out to you when you were thinking about that? Or to anybody else, not putting it just on you, but to anyone, do you say, oh, this is something we should do? This is a group that we should work with.
Parks, I feel like is really, and I know we have a sector around parks, so I think we've already started down that path, but I think partnering with the parks could really be a great start. And I know the group that presented for the parks presentation, they were talking about some of the things that the parks, National Parks Association has provided, these community health hubs. And I think that's just a great start of how we could get the message out to the broader area. And you know, obviously parks are a great place to go and be physically active. So I see them as probably like one of our probably stronger partnerships.
Mm-hmm. Do we have others? Flip it over to opportunities. If there was anything on this page that you thought, oh yeah, this was a great opportunity. We should capitalize on that.
I mean, for me, I still feel like the leveraging and learning from others. And I think the KC Physical Activity Plan and like the sector groups is a great opportunity for that. But maybe expanding that a bit more. I don't know what that would look like, but whether it's the communication piece, and then communication was brought up of just getting the information out more to those who need it. I know that this summit, I think Evelyn said it's every 2 years, but is it something that it's more frequent, or I don't know. I feel like there's a lot of learning that can take place, and don't recreate the wheel when it's already created, especially if we look at other other states or regions of the country.
I think in all sectors as well, there's been a decent amount of staff turnover and new staffing that need to be brought up to speed. And so that also speaks to some of the frequency piece of getting the information out that that can be an issue in many different sectors. So yeah, that's a great point. So we're in this space until 11:40. I was going to circle back on that first comment about the central location. And then I also heard on parks and the community health hubs. And I was thinking about how that relates to some of the other barriers and that relates to some of the other opportunities, especially for everyone, regardless of what language is their primary language, regardless of how they engage with the community. So are there opportunities with that central location of information with the parks and the community? I'm not sure I know what community health hubs are, but are there opportunities there to actively engage with all members of the community in a really creative way? You know, an easy example is we have to make sure they're in different languages, right? So, sorry, go ahead.
Yeah, and definitely, and of course, the parks, they do have their central location of a website and newsletters that go out to people. But something else that they could do to maybe, as we're talking about trying to, with people speaking other languages, is have signage within the park that is in different languages, so they know where to find things and programs that are going on within the park system. And a lot of parks they're small park areas in different neighborhoods, and that's another place too, is, you know, not everyone is going to a website to get their information. Just having some type of resource within that kind of residential park that can point people to programming and services, and could then lead them back to a website for more information. I noticed on this could be helpful. Something, and I was always going to check it out, and then I never did, but Heartland Conservation had some signage in Cliff Drive with a QR code for some kind of adventure exploration summer program that they had. So signage like that, you know, that has like a QR code that could take you to a website for more information, but having that physical signage there for people who may not first think to go to the website to find more information, but that's something I think the parks could have at each of their locations.
Yeah.
You know, I think that despite all of the negative things that came out of the pandemic, there was also a lot of positive. And I think the use of technology and how do we capitalize that to reach audiences in a new and unique way regarding physical activity. I think in the past, physical activity programming was always, you know, meeting at a central location like a park or doing whatever. But how can we reach those audiences who maybe can't travel to the park, or you know, they are used to virtual learning now. So would a virtual programming and providing them resources to their house to then engage in this virtual programming, what that would look like. But I think capitalizing on it, kind of expanding our traditional thinking of physical activity being something that you like meet somewhere, or have to go somewhere to do it, whether it's a school, whether it's a community center, but more meeting people at their houses now, that people are kind of used to that virtual world, I guess.
Yeah, definitely. Which is a great segue to back to our virtual world. And on this priority board for our Jamboard, if we can put some of those priorities out there. Now they're saying you put 3 on a sticky note. Our group has had a little bit of attrition. So we do have a few members that are still here. So if you want to put them all on one sticky note, I think that's fine. If you want to do them on separate, it's whatever you feel comfortable doing. So you're going to put the instructions say you put your top 3 opportunities on which they should focus their efforts moving forward. So each participant should list their top 3 on one sticky note, and then we can read and reflect on those. We have until 11:40. So we have here a couple of things that we've talked about, the finding a central location for resources. And so that could be a website, could also be, and I love that idea of having information in the park as well. Having that information there for people that don't necessarily know that the website exists. So thinking about that in a multi-layered communication approach. We have create a stronger partnership with Parks and Rec. And we talked about that, but I think that does go back to the central core of this group and thinking about the collaborations and the partnerships within this group and creating that stronger partnership with Parks and Rec. I think they do amazing things. Parks and Rec, I'm on a couple, I live in a small town though. And so I'm on a couple of boards in our small town. And I know that Parks and Rec definitely have a strong presence in both of those. But if we don't have that communication and that ability to communicate, then that's definitely something to look to. We have communication, access, partnerships. So those are your 3, right? So communication, access, and partnerships. Creative and innovating programming, engaging in outside the traditional. Accessibility. Oh, loving these, you guys. Thank you so much. I think this would be a good opportunity for each of you to talk about your own, or you could talk about another. So if you want to say why, why is this important to you? Why do you think that this is a priority? This would be a great opportunity to share that. It may feel like we're kind of talking about the same stuff over again, but maybe you have a story that you'd like to share.
Excuse me. I'm the communication access partnerships one. And I think those are broad categories that have lots of things under them. But communication, we very quickly established there's a lot of really good things happening in our communities already, that because of things Chelsea brought up, time, effort, energy, other resources, our energy needed to go to other resources and things we don't just hear about and we don't have time to hear about. So finding those creative ways, and that's not my area, of pushing those out there. I work with so many families who come at me and be like, how did I not know? I work at a preschool that specializes in children with visual impairments as my primary job. My secondary job is at an outpatient clinic. And time after time after time, I'm having to console families that it's okay, you didn't know, now you know, and things. So like, let's help people know in those different ways. Type thing, access, languages, spoken language, written language. Because of the visual impairment piece they'd be after me if I didn't say Braille access. It's more common, but it's not everywhere. Type things. I love the idea of the QR code because it takes you to things that if you know the QR code is there, at most everybody has a camera on their phone they can access it with. Type thing. And just those partnerships are going to be huge because the more people you have at the table, the more chance this is to move forward and to become an active thing and not just a forgotten thought after we walk away today.
Yeah.
Because we all get tired eventually.
It's true. It's very true. I think there's been a lot of tired going on. A lot of that.
I was just gonna say that I think you need to like really know the community, because I feel that like to promote like events and things like that, you need to go where most of the people are. So, I mean, I used to live in the northeast area of Kansas City, Missouri, on the Missouri side, and I feel like the Hispanic community over there, it's very big. So I feel like there are different areas that just talking about Parks and Rec, like they could partner with some of the some of the groceries over there to promote the physical activity. I mean, the groceries are always very packed, and just that would be like a great area to like, maybe create even some partnerships with them as well to reach that community. And I can only speak about that area because that's where I used to live, but I'm pretty sure that is very similar to other areas or communities.
I saw a great picture of from our immunization program that there was a group that they were giving out information on vaccinations on the sidewalk outside of the grocers. Yeah. And saying, can we give you a vaccine today? And I was like, you guys are literally on the sidewalk. They go, yep, we'll go where we need to go. So that is very true. So we are coming up to our time limit. We got a couple more minutes. Anyone else want to share anything?
I think one thing that every organization kind of gets caught up on, or even coalitions, is, there's all these great priorities or great ideas, but sometimes it just takes like focusing on one specific thing to get it moving. I mean, when there's several things and several, like I know with the sectors, they have like their kind of 3 top priorities, but sometimes even that, you're focusing on all 3 and not really just diving 100% into one specific thing, which I think can sometimes hinder progression and advancement forward. So although, all these priorities are great, I think it really just like you just got to take a deep dive into something and to really advance it forward. And then I think people always get caught up of, is it the right one? Is it the right priority? Is it, what are the steps that we need to take